Michelle Buckley from Iowa State University. There are lots of rules that govern how we use antibiotics in livestock, and especially in goats as a minor species. One of the reasons that there is so much regulation of these drugs is over concerns about antimicrobial resistance development. Today, we're going to discuss how the risk of antimicrobial resistance development affects antibiotic use in livestock. To understand how antimicrobial resistance impacts livestock production, we first need to discuss what happens in the body after a drug is given. Drugs do not immediately leave the body after administration. How long a drug remains in the body varies by medication. All drugs gradually decrease in the body over time as the animal eliminates it from their system, usually through urine, milk, and feces. Some of the compound is usually broken down in the body before excretion, but some remains in its active form throughout the process. During the drug approval process, the FDA establishes withdrawal periods based on studies evaluating how long it takes animals to clear drugs from their bodies, as well as considerations for any adverse effects that humans may experience from consuming various low levels of these compounds. This data is usually based on rodent models, and studies are not carried out in humans. It's important to note that the tests used to measure drug residues are incredibly sensitive and can detect minuscule amounts of drug. Think along the lines of a drop of food coloring in a swimming pool. We still have much to learn about how these antibiotic compounds impact the world outside of the patient after excretion. So, how does antimicrobial resistance play into all of this? Well, technically, anytime we use antibiotics, we risk development of antimicrobial resistance by exposing bacteria to selective pressure. Certain organisms within a population may carry special features, such as dormant resistant genes. These bacteria are more likely to survive antibiotic exposure if the length of treatment or dose of the drug isn't high enough. As antibiotic levels decrease in an animal's body after treatment, bacteria inside and outside the body may be exposed to low levels of these drugs, which may select for those organisms with additional survival tools. If enough of those organisms survive in one location, they can cause problems for the animal host or for other animals or humans that might come into contact with them. It's important to note that there's still a lot that we don't know about how antimicrobial resistance develops and what risk this imposes on humans and animals. We should also remember that these same concerns apply to antibiotic use in companion animal and human medicine, as well as livestock. Finally, remember that the risk of developing an antimicrobial resistant infection from exposure to livestock treated with antibiotics appears to be quite low, thanks in large part to the efforts that producers, veterinarians, and processors have made to improve the judicious use of antibiotics in food-producing animals. At this time, all of our knowledge indicates that when animals are affected by clinical disease, antibiotics are still the best choice for maintaining animal and human health and welfare. So, how can we minimize our risk of causing development of antimicrobial resistance? Only use antibiotics if you and your veterinarian are sure that the disease in question is caused by a bacteria. Because viruses and parasites are not killed by bacteria, antibiotics are not an appropriate treatment choice for these diseases and could put selective pressure on the patient's normal flora, which is the natural bacteria that lives on the animal's skin, GI tract, and other body surfaces. You should also document all drug use with the date of administration, animal identification, route of administration, dose administered, and withdrawal time. I also recommend documenting the date that the animal's withdrawal time is up to make absolutely sure that everyone is on the same page. Using visual identifiers such as leg bands or livestock spray paint are also useful reminders for employees that animals have been treated and they cannot be used for food purposes. Your veterinarian should be an integral part of your management team when it comes to developing treatment protocols, setting withdrawal times, and monitoring and maintaining treatment records. Finally, remember to test milk from treated animals once their withdrawal period is up to be absolutely sure that she does not have any prolonged residue shedding before she returns to the milking string. Feeding hospital milk to young stock is not recommended as it does contain antibiotic residues and may affect the normal flora of the animals that consume it. Antimicrobial resistance is a complicated topic that is an area of active research in human and veterinary medicine. However, it's deeply connected with the laws that govern how antibiotics are used in the United States and around the world, so a basic understanding is essential for livestock producers. If you have more questions about antimicrobial resistance or any other dairy goat questions, please email them to dairygoatextension@iastate.edu. Thanks for watching.